This is the In Focus podcast from The Hindu.
Welcome to the Hindu's In Focus podcast. I'm Zubaida Hamid, your host for today. A recent study published in the journal The Lancet Global Health brought out a staggering figure. Almost half of all Indians are not sufficiently physically active. Between 2000 and 2022, the number of adults who engaged in insufficient physical activity increased from a little over 22% to 49.4%. Women were found to be more physically inactive than men, and across the world, South Asia was ranked second highest in the number of adults being insufficiently active after the high-income Asia-Pacific region, which came first. World over, the study found, about one-third of all adults, around 31.3%, were not sufficiently physically active, and if this trend continues, researchers said, the target of reducing physical inactivity by 15% globally by 2030 will not be met. An adequate amount of exercise has for long been known to help prevent multiple non-communicable diseases, including hypertension, diabetes, and heart disease, and is also known to promote mental well-being. India holds the dubious rank of being one of the top countries in the world when it comes to obesity and diabetes, and has a high burden of heart disease, and yet the amount of physical activity Indians do is decreasing. Why are Indians not exercising enough? What amounts to an adequate amount of physical activity for an adult per week? How is the lack of exercise going to affect the massive burden of non-communicable diseases in India? And what can be done to encourage physical activity right from the school level to communities and in offices? We delve into all of these questions and more with Dr. K. Srinath Reddy, Distinguished Professor of Public Health at the Public Health Foundation of India. Welcome to the Hindu's In Focus podcast, Dr. Srinath Reddy.
Pleasure to be here with you.
Thank you, Doctor. Doctor, let's get started. Nearly half of the Indian population is not sufficiently physically active as per this latest study, and that's a staggering number. Could you talk to us about the significance of this study published in the Lancet recently?
Indeed, there's been a great deal of concern about inadequate physical activity in the Indian population, especially in the rural population, also apart from the urban population where it has been a problem for quite some time. But the fact that we are now seeing inactivity levels being reported also in the rural population means that it is much more of a generalized problem. And this has been noted over the last 2 decades in a number of studies. And as I said, the urban population was particularly identified as at risk, but in recent studies, we are also getting some concerns about rural population. And the fact that the ICMR study has identified that between 2000 and year 2022, there's been more than doubling of the physical inactivity levels. We have seen that about 22.4% was the adult inactivity level reported in year 2000, and now it is 45.4%. So we have had several studies. We have had the ICMR multicentric study. We have had the INDIAB study on diabetes, and which also looked at physical inactivity as one of the risk factors. And of course, now the full collated study that has come in from the WHO study. So physical inactivity has become a major problem across India, both in men and women in particular, and also now both urban and rural. And this is a matter of great concern.
Let's get into the men and women in particular. Women have been found to have higher rates of physical inactivity. Has this always been an issue, or is it something that we're particularly seeing now?
It has been an issue, particularly of urban women. When we have seen in our own epidemiological studies that we conducted in the 1990s, and over the course of several other epidemiological studies conducted by other colleagues in India since then, we have found that in urban areas in particular, women tend to become inactive from the age of 35 onwards, and from the age of 45 to 55, the inactivity levels increase markedly among women, urban women, particularly because of a number of cultural constraints. They do not take part in outdoor physical activity, and they are, of course, quite occupied in household activity, but that doesn't necessarily amount to exercise or health promoting physical activity. It's much more of exertion than exercise. And we saw that from the age of 45 onwards, particularly physical inactivity decreases markedly, and we also saw obesity as a accompanying phenomenon. And this has multiple cultural factors also linked to it. Women do not really go outdoor for exercise, unlike rural women who used to actually have group activities. Urban women do not have many of the group activities. But now, across India, both urban, peri-urban, and rural areas, we are seeing women having lower levels of physical activity than men.
Talk to us a little bit. You mentioned the risk of obesity, which is, of course, one of the many risks associated with the lack of physical exercise. It's also been linked to a heightened risk of non communicable diseases, including heart disease and diabetes. And you just spoke to us about the urban rural phenomenon, how this is spreading across rural areas as well. Indians at an added risk also because they're more susceptible to, for instance, developing diabetes.
Yes, because we know that for a variety of reasons, Indians have a greater amount of body fat in their body and lower amount of lean muscle mass. And this is related partly to epigenetic conditioning rather than actually the genetic modification. It's mostly related to the way our diets and across generations, how our undernutrition patterns in our earlier generations have conditioned us or programmed our genes in terms of the expression, so that we tend to actually accumulate our calories now in terms of fat and particularly abdominal fat. And that is associated with a much greater risk of inflammation and diabetes, accompanied also by high blood pressure and cardiovascular disease. And this is a considerable amount of risk. But we know also that physical activity makes the muscles particularly more insulin sensitive. It reduces insulin resistance. So it helps to prevent diabetes. So if we are prone, for whatever reason, because of our diet and because of our epigenetic conditioning, to develop diabetes, if we are also physically inactive, then we do not have any protection, because the muscles are now going to be insulin resistance, and that's going to result in diabetes and increased risk of glucose intolerance in multiple forms, from prediabetes to diabetes.
Talk to us a little bit about the risks or the benefits of physical exercise with mental health as well.
Well, obviously, physical activity has multiple health benefits, both on physical and mental health. I mean, apart from preventing or reducing the risk of diabetes, heart disease, high blood pressure, it also improves bone strength, improves joint mobility, and keeps the body weight under control. But one of the important elements is it also helps to reduce stress, because interestingly, purely from the point of view of evolutionary biology, our own response to mental stress is very similar to the demands that high levels of physical exercise pose for us. So we have a conditioning of the body, if through physical exercise, to cope with higher physical demands as well as higher demands on our emotional state and our mental stress. So it's a very good stress coping mechanism. And if we do not adequately exercise, we are much more prone to anxiety, depression, and a variety of other mental health effects. So this is very well documented as well. And indeed, it is also known that your ability to face any kind of challenge in terms of a stressful situation is much better if you're physically better conditioned through regular physical activity than if you're not. So, whether you're a student in a classroom facing an exam or somebody facing the boss in a very tense office meeting, your mental stress is going to really push up your blood pressure. But if you have been regularly used to exercise and physical activity, then even that stressful challenge is less likely to result in a rise of blood pressure or breakdown of your composure.
Define what regular physical activity means, doctor. You said a little earlier that for many reasons, including cultural constraints, while women do a lot of the household work, it does not translate into the correct amount of physical activity that is required.
Well, there are two elements of what physical activity does for us. One is consume calories, and if we actually consume calories in sufficient quantity, it keeps our weight under control. But it also helps to condition our uh, blood vessels, our heart, and even the membrane of our skeletal muscle, and in terms of insulin sensitivity. And those are the kind of benefits which actually come with higher levels of physical activity, which are done on a more regular and somewhat sustained manner. The WHO, the World Health Organization, defines regular desirable physical activity as 150 minutes of moderate physical activity per week. That means approximately about 30 minutes a day for 5 days a week, or 75 minutes of vigorous activity per week. That's half of moderate physical activity, but it is vigorous. So these are the things that condition you both in terms of your blood vessels responsiveness as well as in terms of your insulin sensitivity of your skeletal muscle. And that's what is meant by regular physical activity. Of course, minor things that we do by just doing a few things at home or just walking a little bit about in the home also are helpful in consuming calories, but they do not condition your blood vessels and heart and your skeletal muscle membrane the manner in which a more sustained physical exercise or activity does. So both are beneficial, but one is more beneficial than the other in terms of reconditioning your physiology.
Talk to us a little bit about the numbers. You spoke to us about how the physical inactivity has increased between 2000 and 2022 now. Do you think the COVID 19 pandemic played a role in this? How does increasing urbanization and more computer based jobs contribute to an increased sedentary lifestyle?
The trend was very much evident even before the COVID 19 pandemic, but the COVID 19 pandemic exacerbated it. We know that with increasing urbanization, we tend to actually uh, reduce our levels of physical activity occupationally also. I mean, instead of working in the fields as agricultural farmers or agricultural workers or artisans in villages, urbanization itself moves us into offices, into sitting in front of desks and sitting in front of computers, and then doing a lot of work over there in a very sedentary, stationary manner. And we have multiple labor saving devices that we have acquired, which also reduce the amount of physical work we do. Even our transport is now much more mechanized, and we walk less and less to work. And if we do not actually undertake leisure time physical activity, then our household physical activity as well as occupational physical activity are much greatly reduced. So we are now seeing the consequences of increasing urbanization. We are also seeing that with COVID 19, people were confined to home and became much more dependent upon digital devices for communicating with each other. And that has now carried over into the post COVID phase as well. We are much more comfortable with our Zoom meetings or other types of video conferencing. And we now have smartphones on which we communicate with each other in multiple ways. And therefore, even the idea of walking across to a colleague in the office is now substituted by a quick email. Now, all of these have actually reduced the amount of physical activity, and COVID certainly has brought about a culture change in the way we are dealing with many things in terms of communication, whether at work or in our social life.
Did our leisure patterns also change because we consume, say, social media or just basically screen time or device time more in the form of a leisure activity rather than maybe going to the park for a walk?
Yes, certainly, because I think we are much more comfortable now in communicating with each other on social media. And we particularly should be worried about the younger generation who are digitally hyper connected but emotionally disconnected as a result of lack of socialization. And that is a problem that's happening across the world. But even in India, we are seeing that happening much more. And that reduces both the aptitude as well as the time allocated for physical activity.
Talk to us a little bit about senior citizens, Doctor. One of the things the study pointed to was also the lack of exercise amongst those aged above 60. What does this mean in the context of India? You said that one of the things physical activity was really useful for was to develop and strengthen your bone and muscle mass, correct?
Absolutely. It does strengthen your bones, it strengthens your joints, and it improves your mobility. It helps you maintain a good posture, and particularly helps you retain your balance, and that reduces the risk of falls. Falls can be extremely dangerous among the elderly because falls can result in fractures, immobilization, blood clotting in the veins, which may travel to the lungs, and a bad fall can trigger a downhill course in health and may even actually result in early death. So I think it's absolutely important for retaining balance and mobility and muscle strength and joint suppleness that we have our elderly undertaking much more regular physical activity than they're doing now. But we need to reduce the barriers as well. There are so many social barriers that come with urbanization. There are no safe pedestrian walking paths. There are no community green spaces. There are no protected cycling lanes. I mean, there are, but not as much as there should be. So, with increasing urbanization, we have not paid adequate attention to all of these, and we have left it to people to do whatever they choose on their own without providing them the kind of amenities that are required.
Another interesting facet of the study was it was the fairly well off or fairly high economic bracket population, say in Asia Pacific and South Asia, that was particularly marked out for a lack of physical activity. How does this correlate, Doctor? Is there a correlation between earning more and exercising less?
It is a phenomenon that has been seen even in the West over the years, but there is progressive reversal of the social gradient. What happens is that initially the risk factors for diabetes and heart disease, including physical inactivity, are much more in the upper social classes who have more money for buying labor saving devices and have a much greater amount of comfort at home, and do not have to really work outside with physical exertion for their living. But over a period of time, you recognize that with increasing availability of financial resources, as well as a greater awareness and knowledge about the risk factors of heart disease and diabetes, the upper social classes, the more educated, and those with higher income start changing their lifestyles. They undertake more leisure time physical activity. They also adopt healthier dietary patterns, and they give up smoking. So then the problem becomes much more concentrated in the middle class, and then later on in the lower social classes, and the social gradient reverses as we find that, for example, that the lower social classes are now much more becoming obese as well, putting on more weight, whereas the real upper social classes are now undertaking much more of physical leisure time physical activity and also adopting healthier dietary habits. So the social gradient has reversed in the West. It has done in Europe and America. In India, rest of South Asia, and Africa, the social gradient is reversing in some of the cities, but not all across. But it will reverse unless we take definitive steps to encourage population wide physical activity and better diets while providing them the kind of amenities and lifting the barriers. As I said, we need to create environments which are much more supportive of physical activity, uh, which are safe and pleasurable, like community spaces, safe pedestrian pathways, and protected cycling lanes. These are some of the things that are required, and mass transport systems, which are also coupled to some level of physical activity. Those are going to be important as we move along.
Talk to us a little bit more about this, the need for governmental policies to encourage physical activity. Does it need to start, for instance, at the school level itself? Does it need to be promoted more?
Yes, it does. Certainly, it's important that at every level we should do it. But because we find that if our children or young students in schools are not having adequate physical activity, their lean muscle mass will not grow. It will become much more insulin resistant. They will accumulate more body fat, especially in the abdomen, and then they will become much more prone to diabetes, high blood pressure, cardiovascular disease as they grow up into adulthood. So it's absolutely important that we encourage not only the right kind of dietary habits, but also couple it with adequate amount of physical activity so that they increase their lean muscle mass and improve the insulin sensitivity both of the muscle mass and of their abdominal organs, and their ability to then protect their blood vessels from the ravages of inflammation. So it's absolutely important that we do it. Interestingly, it also will protect them against stress. There have been studies done abroad which show that when challenged with complex mathematical problems which are likely to induce a lot of stress among students uh, in a school, the children who are doing regular physical activity had much lower level of rise in blood pressure than students who were sedentary. None of them could do the complex math, but the response to that stress was very different. Those who were doing regular physical activity were much better protected against the effect of stress. So I think it's absolutely important that we encourage physical activity both for physical health and mental health in our school environment.
Last question, Doctor, before we sign off. Just another little addition to what we spoke about a little earlier, the need to set up safe environments in public to encourage physical activity. We also spoke a little bit about women not being able to access these a lot because of cultural constraints. Should there be more awareness for specifically directed at adolescent girls and women? And should there also be safer spaces for them to be able to access?
Absolutely, it's very important. I mean, old in rural areas, about a few decades ago, maybe we had women doing a lot of group activities at home and even outside together in a variety of ways. And now that has decreased even in rural areas because of a lot of cultural taboos that have come in. But women should be free to do outdoor physical activity individually or in groups. That means we must provide them safe environments where they should not be subjected to violence or even harassment. At the same time, in schools, colleges, girls and young women should be participating in much more organized physical activity programs and sports, and we should ensure that women have the ability to undertake physical activity, whether individually or in groups, with a great deal of safety in whichever environment they're working in. It's also important for us to remember that whether men or women, even if we are not able to regularly undertake physical activity in the manner that we should, there are a number of ways, even while sitting at home, you can actually do a fair amount of physical activity. You can do stretches. You can move your limbs even while sitting at a desk. And of course, if you can have stand-up meetings in offices, that's fine. You can even have walking meetings in offices, or people can go to a park and have a meeting while walking, walk the talk literally. So there are a number of ways in which can be done. So I don't think it's absolutely necessary that people should go to a gym to do physical activity. We should not make that a requirement. In fact, it's the paradox of modernity that previously people used to be paid for doing physical work. Now they have to pay for doing physical work by acquiring gym memberships. That's not really needed. We should create opportunity for physical activity at home, in offices, in community recreational areas, but all of them with safety, and particularly for women.
Thank you so much for speaking to us today, Dr. Reddy.
Most welcome.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.